Hello and welcome everyone to our panel today, part of the science fair organized by QBI and the Department for Science and Technology of the Embassy of France in the United States. First of all, I'd like to thank again QBI for their fantastic work in organizing this week of panels, and all the panelists that were kind enough to come and share their expertise with us today. The panel today is titled Breaking Walls to Build Bridges, and it asks a lot of questions: how to collaborate with sensitive data, with what infrastructures, with what regulation, and with what money. The confusion of the beginning of the pandemic made only clearer the fact that in absence of protocol for health data sharing, we'd lose precious time in case of emergencies. For example, the sharing of scans of lungs was met with confusion as to the rules that applied in these cases and really slowed the process down that could have maybe saved lives. But at the same time, this first imperative is met or opposed with another one, which is the sensitivity of the data when they come to health and that kind of personal information. The question of sharing data across the Atlantic, not only for health, but in general, is a cause of many debates in Europe, as the Privacy Shield has illustrated recently. Therefore, to ponder those two imperatives and to really start questioning them and understanding them better, and to try to find technical solutions as well as regulation ones, I'm thrilled to welcome the panel today, composed by Mona Flores, the head of medical AI at NVIDIA, Lynsey Chediak, the lead of Future of Health and Healthcare at the World Economic Forum, Romain Pirracchio, who is a professor of anesthesia, but also the vice chair of the Department of Anesthesia at UCSF, Emmanuel Bacry, who is actively working on building the French Health Data Hub, Bishen Singh, who's the director of data strategy and innovation for the Department of Health and Human Services, and Xavier Bressaud, my colleague, who works at the Embassy of France in the United States and who's going to be the moderator. So without further ado, I'll let him take it from here, and I wish you all a very nice debate and conversation.
Thank you very much, Maxime. It will be a hello all, and let's say it will be a pleasure to moderate such great panel. We are going to focus, well, everybody's focusing on data. We are going to focus on the idea of sharing data. Sharing data is a difficulty already at a national level, at a state level, at a national level, in the US, in France, in Europe. And it's even more difficult if you want to share at the international level. But first, maybe, well, hospital researchers, companies, institutions collect a lot of data, health data at different levels for different purposes. And, well, the first question we could ask is, what does it mean to share data? Why should they share data? And let's start by asking what it means to share. Maybe Emmanuel, can you tell us a little bit your point of view on what it means to share data?
Sure. So sharing data is, of course, not about opening data to everybody. It's not saying health data should be open data, of course. It's about giving access to researchers, for instance, in a secure environment, and giving access on giving access to individual data. This is very important because if you are a researcher, you want to have access not to aggregated data only, but you have to have access to individual data that have to be then pseudonymized, of course. That is very important so that it is secure. Now, what are the goals? I would say mainly there are two very important goals. The first one is that at the era of big data, we all know that at a certain point when we have huge database, for instance, of images, we know that increasing again the database is good, but maybe it's not the best way to get more and more information. But the best way is to be able to chain different, very heterogeneous databases together. So taking images, genomic data, biological data, and so on. If you do that, if you join if you make all these databases interoperable, then you'll multiply the information you have in your sources of data a lot. So for that, you have to access very different kind of data. So sharing data, that's the first thing. Second thing, if you want to operate a project on a national at a national level, then of course you have to ask all the institutions, the local institutions, the hospitals, and so on, to share the data together. So that we need to operate this thing. It's really about breaking the walls, and God knows there are so many walls. You cannot imagine how many walls there are. You can call them normalization, interoperability, governance, valorization. We'll be speaking about all that, I'm sure. And it's really a very actual problematic. We saw that for the COVID-19 crisis, that it is so hard to share the data quickly, and that it is really, we have to really move, and I think all the countries have to move in order to do so, and to be able to operate that very, very much quicker than what we are doing right now.
Thank you very much. Maybe Bishen, you can tell us about your experience on this kind of problematic in the US.
Sure, yeah. To add on to what Emmanuel was saying, I think building trust is really important as well in terms of coming to agreement around, what data needs to be shared, how it needs to be shared, and the parameters for analysis. So at HHS, our goal is to optimize the health and well-being of the American public. And the way we think about it is to develop a holistic understanding of the individual. And so the data types that are most relevant to us that we focus on sharing and analyzing are biological data, scientific data, clinical data, even social determinants of health data, which we found to be very relevant to the COVID response. And I think that's been seen around the world as well. And the approach we take to sharing the data is really a use case driven approach. I could tell a story, Admiral Brett Giroir, who joined HHS in 2018, who was critical in the COVID response. When he joined, he was focused, one of the things he was focused on was addressing the opioid epidemic. And he had a conversation with us in the office of the CTO, and he said, how do I find out what data sets exist relevant to this opioid use disorder problem that I'm tackling right now? And because the data was so fragmented, it took us a while to figure out, the answer to this problem. But what we ultimately ended up doing was developing a landscape analysis of the different data sets that exist, whether they're at NIH, CDC, our private sector collaborators, or even with nonprofits. And then we put them together. We developed some parameters around which we had requirements and standards so that they could be shared. And then we automated some analysis pipelines that saved time along the way to get a sense of the landscape that exists around this opioid use disorder epidemic. And what that ended up doing is helping him develop an action plan to get patients access to treatment for opioid use disorder. So I think based on that experience, what's really important to sharing data and data interoperability is developing actionable use cases through which the return on the investment of data integration and analysis can be maximized.
Thank you very much. Maybe I could ask to Lynsey, for instance, to talk a little bit about the risk that are involved in this. Well, we see the benefits we can have in sharing. What are the risks?
Absolutely. And thanks so much for having me on the panel. I think this is a really important topic, and I can't agree more with the prior comments made on this role of the use case. I think thinking about the use case of why you want to access data sets and run these analyses has to drive most of the decisions, because what's shared and why will also stem from that and also dictate if the risk is worth it. So at the forum, we're really thinking about how to achieve a personalized approach to healthcare and precision medicine. That, of course, is not possible without access to large amounts of data and sensitive health data at that. So one way that we think about risk is specifically with, for instance, genomic data. Genomic data can tell a lot about you, sometimes too much, but it can also hold the answer to a disease you have. So for instance, with rare diseases, 80% of them are genetic in nature. We don't know a lot about them. It takes an average to have a diagnosis in 5 years, which is very long. And we're seeing about a third of patients die before their 5th birthday when they have a rare disease. There is already a risk there. So the risk of a data breach or having your privacy revealed in data access is arguably a risk you're willing to take. I think in other use cases, when you think about, for instance, maybe with cancer, where you have a high chance of survival and you may not want people to know you have cancer, and that of course varies by country based on the stigmas that are apparent. You may not want to risk your privacy being revealed. And on the other hand, I think we have to consider benefit sharing. So if you are going to take that risk and have your data be potentially accessed by additional researchers as a patient or in a clinical trial, all sorts of use cases, is there a feedback mechanism and a way that as an individual patient you can benefit from that risk? And I think that's one part of the equation that is missing these days. So often when you are sharing your genomic data, for instance, I'll use that as an example again, that is your most personal data, that is you fundamentally, and submitting that, it can answer a lot of questions about your health. And so it'd be great if we could work together as a community to figure out how to re-notify patients if something important comes up. And I think that benefit sharing mechanism ultimately will reduce the perceived risk of contributing your data to some of these big data consortiums that are popping up.
Thank you. So it's a question of trust and maybe of understanding, maybe by the citizens. Emmanuel, I heard you had insight on this question. You're especially sensitive to this question. Maybe you can add a word.
Yes, I think it's very important to explain, and it would take a very long time. I'm not going to do it now, and Lynsey already did a little bit. What are the risks and what are the benefits? But about the risk, we have to be careful, because when we were saying that sharing risk, there might be privacy problems, and privacy can be revealed. This is supposition. I mean, if you are working on pseudonymized data, it's not that easy. Even if if there is a leak of data, it doesn't mean that privacy is revealed. I mean, the risk comes later. So we have to be careful not saying that sharing, then if somebody has the data, that's it, privacy revealed. No, there are more steps to that. So that's the first thing I wanted to say. Now about trust. So the jurisdiction is pretty different in Europe, in the US, and so on. I think it's important to recall that. Like, for instance, in the US, the citizen owns its health data. In Europe, there is nothing such a thing like an ownership of data. It doesn't exist. Okay, your health data is an attribute of yourself. You don't own it, so you cannot sell it. Okay, now, of course, in almost every country, I would say, you have the citizen has the right to forbid the access to his or her data, or to authorize the access to the data. So this is a basic choice, which I think is very important to be in the hand of the citizen. Now, there is one thing I'm really bothered by, is that the choice of the citizen today, I think, is to say no or yes, is not an informed choice. The choice is basically driven by some fantasies, because it's so hard to understand what it means what it means, what are we talking about health data? What are we talking about sharing? What does it mean? What are the benefits? What are the real risks? And there are so many fantasies in the head of people, and it could be positive fantasies like, oh, great, I'm going to live till 200 years old or whatever, or negative fantasies like, okay, the GAFA are going to take everything and I'm lost and whatever, or the insurance companies are going to score and so on. And so it's very, very, very important, I think, to education, to educate the citizens, to really make them understand what are the real risks and not trying to mask them, and what we estimate are the real benefits, and being really concrete about that, and not trying to imagine what AI would be able to do in 30 years and so on, but really what we can expect in the coming years. And if this is a very, very long process. This is going to be very hard, but I think this is extremely important, so that afterwards the citizen can say no or yes, but this would be an informed decision. Right now, I think it's not at all the case, and this is really, I think, catastrophic.
Okay, that's a clear difficulty we have to address. Maybe, Romain, you can develop a little bit on the benefits or specific benefits of sharing between different institutions of different type of data.
Yeah, thanks a lot. First of all, thanks a lot for inviting me. And full disclosure, I mean, my expertise is not in data sharing initially. It's more in applied machine learning. So I'm kind of maybe the naive person here. So I will kind of take the role of the user, like the doctor here. And so as I think as doctors and as healthcare professional, what we'd like is really kind of to be able to provide the vision. Where do we want to go in the future in terms of using this wealth, this common wealth that is healthcare data? How can we envision using that in a way that, in a couple of years from now, this will actually improve the way we're performing medicine? That's kind of, the general vision. And I think, once we kind of all agree on what we can do, what we could be doing using that, then we kind of need to reverse engineer that and say, okay, well, along the way, there's going to be like a couple of barriers, and there are a couple of barriers that you guys, know a lot better than myself. But if we agree on the vision, then we can start working on the barriers to kind of achieve this vision. So that's kind of the general framework that I'm kind of using when I'm trying to get my head around this very complicated problem here. So I think the vision is that we want to. There's a couple of keywords that we'll always kind of hear about. I mean, the first one is, of course, data is a wealth, and we want to be able to capture data to basically improve the way we're performing medicine. The second keyword is the fact that we want to kind of move away from kind of population-based medicine towards more of a personalized approach. And by personalization, we of course mean that we need to have more data to better understand, what are the determinants of the response to a treatment, for instance, or how to better characterize a disease process, for instance. So I think if we kind of agree on the fact that these are kind of two ultimate goals that we want to achieve, then data are essential here. And I would say when we start again as healthcare professionals, when we start digging into the reason why we really need data there, I think there are three kind of major sub-reasons for, so to speak. I mean, the first one is that, as we all mentioned here, the more data we have, especially for rare diseases or for rare conditions, the more likely we are to understand them and to, analyze and provide like better answers. That's kind of, I would say, the most trivial reason. The second one, which is more actually advanced and connected to what now people are trying to do in terms of bringing AI and algorithmic to medicine. The reason here is that we want to be able to externally validate some of the algorithm that we may be training at an institution or even at a national level. Make sure that once we have something that was actually trained on this population, this will actually apply or not apply in another kind of situation. So that's the second major reason. And I would really like to emphasize on the third reason, which is to me being more important. I think that data sharing is key for the sake of promoting diversity and inclusion in data science. That's a key issue here. We are in the process of reproducing what has been done ever since science in medicine was started, which is basically to build evidence from a subgroup of people who have the chance to access high quality of care. And this evidence doesn't apply in many instances to people who are not lucky enough to get access to this high quality of care. That's something that was called in the past the scientific fracture in medicine. And I'm very much afraid that in data science in medicine, we may actually reproduce that. And there are a couple of examples here where, you know, algorithms that were trained on some specific patient population can actually carry pretty significant biases and sometimes racial biases, for instance, because of the lack of diversity in the data. So I think data sharing is also a way, not the only one, but a way to try to work on promoting more diversity and equity in the way we're developing data-driven medicine.
Okay, thank you very much. So we understand that at the global point of view, there is obviously an interest for sharing. But the institution who collect the data, what would be their motivation to share, and how can we convince them to share the data? Maybe Mona, you have an insight on this point from.
Yeah, it's actually very interesting. We talked about two different things here. We talked about, Lynsey, you talked about the beneficiary and that mechanism that has to be figured out for people to be able to share their data. But there's two sides to it. There is the benefits to the individual, and then there is the benefits to the institutions. And I think that they are a little bit different. You can imagine that actually persons or individuals are more likely to share their data than institutions are, whether it is because they have a rare disease that they believe it can be helped by big data and by people figuring out from a lot of data how to develop a drug for this disease or a treatment. You could see individuals giving their data today to application, apps. You give them any app, and you have this big legal disclaimer that no one reads and everyone just gives their data away, right? So that is one hurdle and one way to think about it. The other one is, an institution that has so much data. Today, data is money. To them, being able to develop an algorithm that they can go and commercialize is really important. And you have to put regulations and governance in place so that people feel they are getting something for contributing this data back. So you have to align the interests of everyone that has the data, from an individual level to a institution level to a government level, so that there can be cooperation.
Xavier, valorization is a major issue about data, and it's a real problem. That's why a lot of institutions don't want to share. I'm sorry to interrupt you, but I was mandated by a prime minister for the first wave to co-head the task force on data versus COVID in France. And I was terrified by the fact that institutions, data producers, most of them, they don't want to share data because of valorization problem. Valorization, even during a COVID-19 crisis, they want to be the first one to publish the paper about whatever it's about. They want to receive the money for that, and so on and so on. This is a major issue.
And we have to find, at the government level, we have to find incentives to make them feel more free of have an interest in sharing. That's already true at any level, but I would like to also to see what is what more difficulties we have when we go to international sharing. And I would like to ask Lynsey if you have an insight on this specific aspect you've been thinking about.
Yeah, absolutely. So the forum has been working on a few different pilots, actually, working with multiple governments and the private sector as well, to see what it takes to stand up data consortiums. And at the end of the day, I think what's fascinating is that we found that about 80% of the work is actually on relationship building. So about 20% is the technology, and of course making sure your data is structured the same and you have similar internal processes. But despite the role of all of these fancy tools with machine learning and artificial intelligence that are just incredibly exciting, it's still about relationships. And actually what we're seeing, going back to this theme of trust, is a mistrust between different actors globally. I think in the US, for instance, I can say this as a US citizen, I think we do things better sometimes in other countries, which is not always the case. There's always an opportunity to learn from one another. And I think what needs to happen to allow for more international data sharing and remote data access is understanding that every country is probably doing something better than another country, and there's a learning opportunity, and it's not an issue of just thinking you're better. Like everyone can learn something, whether or not you agree to do one country's process over your process. As you develop a partnership, you can always improve the way you're working. And I think we rush to want to set up the technical side of it without allowing for that ability to really exchange best practices. And I think if we can approach this as we're all doing something great and that needs to be shared, and that in data sharing, you will not ever establish a consortium doing 100% of what you were doing before you entered that data consortium. It has to be a give and take relationship, and you have to be able to develop a governance model that allows for each institution to share what they figured out, and make sure that actually once you even establish the consortium, the learning process continues, because no one is 100% doing data sharing well. And so it has to be an ongoing process and continue to allow relationships to build.
That's quite an interesting point of view, that humans are more complicated, more sophisticated, more complicated than machine. But well, okay, and every institution, every country has to see his interest in doing this sharing not only of data, as I understand, but also of experience and methodologies and ways of thinking. Still, there are technical difficulties, and maybe we can address them a little bit today. And around this interoperability, we already mentioned. Maybe, Bishen, you have insights. What would be the difficulties if you had to share the data you are dealing with now in the US with other countries? What kind of difficulties, technical, around the more technical aspects?
So I think that planning for the best protection for the specific type of data is critical. I know the EU is under different rules in the US, where the EU has more of a omnibus approach, and the US has a sort of different approach where different data types are subject to different rules and policies and best practices. And then the way we think about it is promote open access where it's possible and appropriate, and then everywhere else figure out what the best protections are in order to protect the patients or protect whatever type of data set it is, if it's genomic or whatever other type, and has its associated level of sensitivity. And this can be thought about at a patient level sort of way, or even a population level way. I think if you have consent, purpose limitation, those kinds of things, then you can do more potentially with certain types of data, whether it's within your country or even if it's international collaboration. Basically, you want to ensure that the data is used for what it's designed to be used for, and it can't be broken down. Like if you have population level data, for example, it can be broken down to a specific patient level, and then the patient can be re-identified. That would be very problematic. So I think having those protections in place is really critical. I think one case where I thought it was done pretty well is the NIH Brain Initiative, where there were a number of grantees who were generating genomic data from patient brain samples. And what they did is they sat together before they started generating data, and they had conversations around what protections would need to be in place in order for everyone to be happy. And those conversations involved the patients as well. And I think that was very important, because all stakeholders need to have a voice. And that means not just the people who are running the experiments, not just the people who are the patients, also the policymakers, also the people who are thinking ahead into the future about, maybe as to Emmanuel's point, not what's happening 30 years from now in AI, but what's going to happen tomorrow in foreseeable future, so that you can sort of future-proof the risks and the potential implications of sharing that kind of data. So I think, it's really important to have conversations around what makes the stakeholders happy, so you can arrive at a mutually agreeable consensus. And I think it takes time, but we've seen successful outcomes, and I believe it can be done in many different use cases and examples.
Thank you. Well, one of the difficulties, the different approach in the US and in France, maybe, well, in Europe more globally, the GD, well, what you are explaining is that on a specific problem, people decided to find a framework that would protect the privacy at the adequate level, at the adapted level. In Europe, we have a general law that tells us how we should deal with data when they are private, and it can make difficult are the rules compatible? That's what I asking. And maybe Mona can tell us more about these tools like federated learning that allow not to share the data, but only the access, and say how it can help respect the rules on both sides.
Yeah, definitely. So if you want to protect data, one, as you said, Bishen, getting consent and enabling the patient to be part of that conversation is great. You can also use, as Emmanuel had said, I believe, and Romain, you can anonymize the data so that people, it's not easily traceable, even though people might have their fantasies of what can be done, but it is not as easy. The other way to do it is to figure out a way to get the learnings and to get the diversity that Romain, I think you talked about being able to get diverse data together to train an algorithm so that we don't have this selective bias that we have in training AI. And you can do that by getting the learnings from these different populations and these distributed data sets without having to get the data and put it in one place, without people having to actually share the data. And this is, one way to do this is federated learning. So at NVIDIA, we have our healthcare platform called Clara. One of the features is federated learning, and it works in a client and, it's a hub and spoke model where you have one server that really never sees any data, but it has a model on it. And then the model is given to different institutions. These institutions do not talk to each other. They just talk to the server. The institutions have their own data, and they take this model and they train on their own data at their own institution. So they're not having to centralize the data in one place and not having to move the data. They don't even have to anonymize it if it's just sitting there at their own place. Once they train the model, they take the weights from the model and share it back to the server. The server is sitting there waiting for all of these clients to get back their weights. It aggregates it, and there's many ways of aggregation, different methodologies of doing that to get to the best model. And then it redistributes these weights to each of the institutions. And they go again, in an iterative fashion, they retrain the algorithm and send the weights back again. And this keeps going on until you converge to a model that works basically for everyone, and that is very generalizable. So you can imagine you can do this for training algorithms. You can also do it for validating these algorithms and making sure that the model that you got works in different places. It's very easy to do the cross-validation for the institutions that participated in this federated learning, but you can imagine even taking it to ones that were not even part of the consortium and validating the algorithm in this fashion. And Lynsey, I have to say, you mentioned that relationships is one of the way these consortiums happen. And I have to tell you, we've done now 3 real-time experiments, I should say, or studies, using federated learning. And the most time was spent on building the consortium, on getting people to trust in the system and to trust that the data is safe, and to be able and be willing to participate in such experiments. I would say it's almost 90% of the time was spent on that, and the other 10% on the training. Once you have people trust and agree that this is what they're going to do, it becomes much easier to do the training and to get a very generalizable model that you can then go ahead and test it in other places. So it's really democratizing, AI, the building of AI, and then the dissemination of AI in medicine.
If I may say one little
Yes,
thing,
of
I'm
course.
sorry again, Xavier.
I was going to ask you if you're interested, Emmanuel, so that's perfect.
No, I think federated learning is very appealing, and I would like to. We are going to try it in the Health Hub. Now we have to also say that it's not that easy, because there are a lot of papers being published also saying that you have to be careful with federated learning, because nobody can assure you that within the weights you don't have data traveling. There are a lot of papers trying to reverse engineering the weights of the algorithms and trying to show you that you can find the personal data. So this is an ongoing subject. I mean, there is no clear-cut conclusions, but I think it's important to say.
Oh, for sure, Emmanuel. There are lots of ways. There's lots of work. This is a very hot topic, and
yes.
Lots of research is going into it. But there's also some ways to mitigate that. For instance, the way we do it is you are not sharing all the weights. You are just sharing some of the weights, and then you're adding noise on top of that. So, and then some other people are putting blockchain.
No, it's an ongoing research. That's the only thing I was saying. It's like an ongoing subject, and there are many things still to solve, but it's very promising. Sure. I'm saying it's very promising.
And again, technically promising, but again, and maybe Lynsey can have an insight. It's a human problem. It's a question of trust between the institution who will build the algorithm and share the access to the data. Maybe Lynsey, you have an idea on the governance of this kind of processes.
Yeah, I was just going to say, I think that is, Emmanuel, you hit the nail on the head. That is the role of governance, right? I think the trust and the relationship building, and actually the education gap, is certainly crucial, because people are scared by what they don't know, which totally makes sense, human nature. But I think having really clear governance, for instance, as you mentioned, yes, it is possible to potentially jiggle around with the algorithm, and I am not a tech expert, so I don't even fully comprehend the level of possibilities. But for instance, in one of the consortiums that we set up, we have very clear guidelines that if you, as a researcher, a clinician, anyone accessing this sensitive health data consortium, ever try to do that, you are out. There is no opportunity for rebuttal or for describing why you did that. You may not even attempt it, and if you do, you lose access permanently. And so I think those sorts of governance mechanisms are really crucial to mitigate for any bad actors, because if we don't assume, if we there are always going to be bad actors, for better or for worse, even in healthcare, when it is an altruistic, you're helping someone's life ecosystem. So I think understanding what flexible governance mechanisms can exist and also can be effectively implemented is really going to be key to the success of the huge potential for federated learning and all of the really great results that can happen from it.
Would it help to have a kind of a third party, a trustworthy third party that dictate the rules or the procedure that would be maybe not a private company, maybe not a government, maybe an institution like maybe we were thinking, I don't know if it makes sense, of the global partnership on AI, for instance, or another kind of institution where maybe Romain, you have an idea from far.
Yes, thanks. Well, I mean, I fully agree with what was said before, and I think there's a lot of potential solutions that seems to be very appealing, and federated learning is certainly one of those. I have to say, again, going back to kind of the user level, there are challenges right now that are much more concrete, like, you know, the challenge of sharing data is at the user level is not like an international challenge right now. It's between my lab and the lab next door, because we're not using the same format, because we're not collecting the same data, because we don't have the same timestamps on our data. So, like, you know, all the things that of course everybody knows here, but which is really still kind of the day-to-day life challenge that we're still we're still confronted with. So to go back to your points, Xavier, I think a third trustworthy party would be interesting in many aspects. Of course, there's like the policy making aspect of things, there's the regulation aspects of things, the valorization aspect of things. That's kind of outside my scope of expertise, but I can totally see a reason why a third party would be extremely beneficial here. But I would say also that we would need to have this kind of third party regulation to now promote, probably in a stronger way, data harmonization across different groups. And, you know, I think now that maybe that's kind of an extreme vision of mine, but I would say that if now public money is involved in, you know, whatever country, it should come together with some sort of agreement and commitment in terms of data harmonization, to make sure that, again, the public money is invested wisely and is actually invested for the sake of you know, building or producing evidence that will be, again, more global than what it is currently. So I would say that this type of kind of third-party regulation would also have to think about a way of promoting that more strongly and with more incentives.
Okay, got it. And well, that goes to another one, maybe the means. If okay, I understand that there are difficulties that are local and at a lot of levels, and we will not solve them in one day. But if we want to prepare and the work for the future and go and think of international exchange or access sharing in the future, maybe we should build projects. Well, if we had means, if we had money to promote cross-border research on the subject, what should we do? What should we do first? Work on this interoperability, or are there other points that we should think about, and how should we work? Well, maybe I can ask the question to Emmanuel.
Yeah. So okay. So we first, I mean, every country has to first work in his country and try to solve this problem, because this is fundamental. So that's what we're doing in the Health Data Hub. Answering the question you just asked before, we chose, since in France, basically all healthcare are partially reimbursed by the National Solidarity, there was a law saying that all healthcare data should be accessible for public interest research. So the Health Data Hub is like a unique gateway to play this role. That's the goal. Now we use third party in order to chain the data, because we are not allowed to have identifying data. We have pseudonymized data. That's the thing. So we have a trustworthy third party for chaining data and dealing with identifying data. That's the way we are trying to solve these problems. Now, of course, it is very important to us to work with other platforms from different countries, and first of all, of course, with European countries, because it's easier, because we have the same jurisdiction. When we are talking about interoperability, these are not just technical problems. It's a lot of jurisdiction problems and stuff like that. It's very, very complex. And we are trying to, right now, to start some projects. And I think I would say the first basic kind of projects we're trying to deal with and to organize, and it's already very difficult. It's just to make some the research teams of different countries working on similar data on their sides, each on their side, on each country, and put the results together to try to publish a paper together. Even just that, so no movement of data, nothing just like that. Even that is hard, and I think this would be a first step that we can succeed to build in short term. We should be within a year or 2 years. We should be able to develop these kind of projects.
Yes, okay, but that's...
Okay. Sorry, I didn't answer your question. I felt frustrated.
Sorry, I didn't hear you.
I didn't answer your question. I feel like I missed the point, right?
No, you didn't miss it. That's already a first thing that should be done. I was just trying to be more ambitious and maybe see if it's not it can be later than in 2 years, but maybe we should prepare now.
So we are already looking at federated learning, trying to build this kind of project, but we know that even federated learning, it's going to take really longer. I mean, several years to be able to build that because of the risk of data leak and stuff like that. But of course, we have to think long term.
To go in this direction is to have teams working together, maybe on the same kind of data without sharing, because
yes. So in France, we have the chance to have this hub. We have a dotation from the government of 80 million euros. So that's quite a lot of money. I mean, it's not like the GAFA, of course, but it's still a lot of money. And there are no such ambition project, I think, in Europe equivalent. But we are, for instance, trying to build partnership with Finland. There is a very beautiful platform called FinData, and of course in many other countries.
Bishen, maybe you could say on the US side, which kind of institution would be in good position to interact with a structure like the Health Data Hub in France?
So this is a little bit outside my wheelhouse, but I think whichever the bottom line, I think, is developing some sort of framework where you're compliant with regulations and also making progress. And the challenge is, to the point of, what Emmanuel was saying along the lines of Finland having good data set. I know the US had an agreement with Finland or some sort of partnership with Finland to work on finding additional treatments for diabetes. And one of the big challenges they faced was getting the data to be interoperable in a way that drove progress while still complied with regulations. And that was, I think, the biggest challenge for them, because the regulations made it nearly impossible or very difficult for them to make that progress. So I think whichever US institution could help change that or help influence the regulations in such a way that would enable data sharing to be made more easy or made faster would be the best one. And I guess it varies from use case to use case. So, if it's health related, then maybe it's HHS or a commerce related institute. But again, it depends on who the stakeholders are and what impact they could potentially have on policy in a specific domain.
Okay, got it. Well, now I'm wondering if we were to build a concrete project, what I mean, thinking of maybe 5 years, what subject, what kind of data, what use case would be more interesting? I mean, interesting in the sense that it would give interesting results, and interesting in the sense that we have a chance to be able to do it before a too long time. And maybe I'd like to ask to all of you, if you see a direction in which we should try to promote, incent actors to try to cooperate, even if it's for the long term. In a specific topic or a really specific use case. Maybe starting with Lynsey.
Yeah, well, I'll actually leave maybe the exact example to the other panelists, but what I would like to mention is I think the prior step to what you're talking about is actually changing the mindset that when you collect any data, you actually think about the fact that you do want that data to be shared with somebody else, because that's often the missing step across use cases, is that when you go into a study in your own hospital or in your own clinic or in your own lab, you're collecting data in a way that you want to use it, right? And you're putting it in a data lake, for instance, in a way that is not very helpful because there's no structure and you're just throwing it in somewhere. If we can actually, across use cases, approach data collection with the notion that it will be shared with someone else, I think we would drastically change the opportunities for that use case that you're talking about, because we're still not thinking nationally or not thinking globally when we actually do the initial collection. If we could, in advance of the collection, have a strict structure that we know that we are following, another lab is following, and even in other countries, that standard setting of collection would do wonders for all use cases. So I'll let other panelists weigh in on maybe the first opportunity.
Thank you. What about
Romain? If I may, Xavier? Yeah, thanks. So I would say, the way I'm kind of thinking about it now is that there's like almost kind of two parallel things that are ongoing. I mean, the one that we're basically talking about today, which is like really kind of very advanced ideas about how to share research data for the sake of promoting better healthcare and personalized healthcare. And kind of almost separately, which is, to some extent very ironic, healthcare professionals are really trying to expand something very much more concrete, which is the general use of electronic healthcare records, EHRs, right? And in many institutions, many countries, there's still no kind of unique way of not even collecting, but putting together all the kind of daily data that we're collecting for our patient in hospital or in doctor offices. And I feel like kind of these two endeavors are still kind of moving ahead in parallel. And we're talking about maybe sharing genomic data or sharing like imaging data, and most often these data are already collected for research purposes, and so this makes it like very specific in terms of the goal and the types of data that we're talking about. But what I would like really to see in the future is kind of connecting these two again, kind of parallel endeavor, and say, well, the real wealth of data is within the unified EHR. That's where healthcare professional and patients are putting all their data in, and that's what we're operationally using on a daily basis. So if we were to really kind of leverage the future of AI, machine learning in healthcare, that would be through the use, the use of AI and machine learning within the EHR. And so I really like to see in the future, to some extent, some sort of a move from data collection sharing endeavors towards more of an EHR-based data sharing concept, where basically we all agree on the way an EHR should be built to share the data and make it kind of AI ready for the future. And this, far from being possible today. I mean, you guys all know that we all have different EHR. I mean, the US is probably kind of a different here, and there's more uniformity in terms of the EHR, because there's just essentially two very big actors that kind of have kind of the entire US market. So it makes it a little more uniform. But there's many countries and many examples where this is completely fragmented, and so I think that's trying to reconcile the way we are using and we're deploying EHRs globally is something that is very important for the future.
So I understand that the idea again is more contacts, people working separately on the same kind of data to understand how the other work, and with the view of trying to unify. That would be the one.
Yes, and I would say really with the goal of using the data that are routinely collected and that are already being used for clinical practices, and not only the data that are being used for research purposes. Because I mean, although they're sometimes the same, they're very often not the same. And the data used for clinical practices and for clinical sake actually come with a lot of different challenges, in terms of data quality, in terms of data granularity, in terms of format, in terms of again timestamps. There's a ton of very specific issues with the clinical data collected on a day-to-day basis that is slightly different than the one that we face with data kind of very nicely curated for research purposes.
Okay, I get it. And maybe, well, on this point, or maybe on other aspect, Mona, you can tell us about your experience. I mean, I imagine you are confronted to the problem.
Yeah, definitely. So I agree with everything you guys said, and I want to go back to Emmanuel. You brought up a very good point. Even in federated learning today, the Achilles heel is being able to get data that is consistent between places. You know, if I tell someone to grab a lactate level from an EMR, I have to make sure that they actually grab the same exact one from the same test. It is easy. It sounds much easier than it is to do. Even when you have specific codes that you tell people to go and get, it gets very complicated. So I think being able to gather the data in a way that you can feed it then to an AI model is one of the hardest challenges, even harder than actually training the model. And the other thing to think about here too is, yes, perhaps we can have in the future some universal EMR. I don't know that that's possible, but we can at least, with the money, like you said, Emmanuel, there's all of this public funds. How can we use it? Maybe we can use it to create handlers to be able to go to different EMRs and different silos of data and be able to collect the data in a usable fashion. So I think, having real data and the ability to collect it is just paramount here. It's really important.
Bishen, do you have an insight or view on a particular point as something we should work on?
Yeah, I think until we get to a point where we're able to share EHRs more comfortably and more easily, there may be lower hanging fruits in terms of data types. I think social determinants data may be one of those data types. And I think what we could do there is come up with a different sort of mechanism to put those different data sets together from across various countries to address a specific use case. Like, let's say we're talking about healthy aging, which I think is an issue across the world now, where populations are getting older and facing new issues, and like, for example, loneliness, or that have economic burden and social burden. If we can put those data types together and come up with some sort of new mechanism, like maybe prize competitions where specific countries who are faced with this issue the hardest say, all right, we'll invest in a pot where people from around the world can pitch ideas and say, let's try X, Y, or Z to address this problem of healthy aging, and we'll give the winners X amount of money. I think that would be really a great step forward in showing that international collaboration results in some really fruitful outcomes. And meanwhile, I think we can hash out the problems related to sharing more sensitive data, because social determinants has the data in that type ranges from not very sensitive to sensitive. So you can start to dabble with the problem there, get somewhere, and then maybe scale into more areas where the question is really much more tricky, like such as EHRs.
Well, that's quite appealing, but as far as I understand, at least in France, social data and medical data are in different boxes, and it's probably more difficult to make them communicate than to communicate with the US. Emmanuel, am I true?
No, maybe you exaggerate a little bit. Communicate with the US is pretty hard. So, but if I go back to the question you asked, so I think there are. I of course totally agree with all what was said. Of course, but if I was to rephrase it in my way, I would say that there are different levels talking about projects. First of all, you can talk about not directly health projects, but how to make health projects possible. So this is interoperability, and I do agree, like what was said, it is a major issue, and for EHR, of course, it is a major issue. It's very complex, and there are so many standards right now, and everybody is using its own, and it's a big mess. So this is a very, very important subject, and we are very active on this subject, and we're looking for collaboration in the Health Data Hub. We're already working on some. Now, if we're talking about applications, so in the perspective of what I said before, with Finland, for instance, we are trying to build this project, which is like kind of a short-term project, I would say, where the two teams will work on their data, and they are actually working on trying to do automatic coding from EHR. This is also a very important issue. And so there is no sharing of data. There are just sharing of the methodology and the results, and to see if what is working in Finland is working in France or stuff like that. So this would be a first step, and I think kind of a short-term project, though it will take at least, I think, a couple of years. But this is short-term, I think, in terms of sharing data. Now, if we really talking about projects where data would be shared, I think, of course, we would love that EHR to be on the list, but I think this is very long term, because at least from the GDPR point of view, EHR is strongly data that can be re-identified data, where you can, where privacy is very hard to anonymize, so it's called pseudonymized data. So it's going to be very hard to share, especially with the US, which is not in the European community. So that makes even more problematic. Now, if we want to go towards some data that should be in terms of regulation easier to share, I would go towards images, of course, where GDPR is not that clear whether you can, maybe we can consider that they are anonymized data. There's still a possibility for that, in which case it would be much easier to share data effectively and to put them together with other countries.
Thank you. I'm afraid we have to stop. I think we are out of time. Well, I'm not sure there's any clear conclusion. Just it's well, I would.
Yes, we all want to share data. Conclusion, and it is very important.
It's important. It's not easy, and we have to. My feeling is that we have to multiply points of contacts. With this problematic in mind. I mean, a lot of people are working together between France and the US doing their research. We must have more people working together with this problematic in mind and trying maybe to capitalize the difficulties and the ideas they have to go in the right direction, and not be too ambitious and try to have a federated learning project tomorrow, but prepare the ground for that. I thank you very much. I have no signal that if we are still broadcasting or not, I'd say. So goodbye to everybody. Thank you very much to you five, and that was very interesting, very rich for me at least.
Thank you so much for having us.